In this lesson, we're going to be talking about working with adolescents. So in this session on working with adolescents in substance use treatment, adolescence is a unique and often really turbulent developmental stage. And understanding this phase is going to be crucial for effective counseling. So during this session, we're going to explore what makes youth different from adults in treatment and how relationships influence substance use. We're also going to look at how to use some developmentally appropriate strategies to build trust and support change. And by the end of this training, you should feel more confident identifying significant influences in a young person's life and engaging them in more meaningful dialogue about substance use, and also developing a treatment approach that balances support and structure. So let's start with reflection. What makes working with adolescents challenging? What should you focus on during your sessions? This is going to help encourage you to explore some real-life obstacles like resistance or lack of insight, family dynamics, and these conversations help surface unconscious biases, and it really helps to prepare you to meet youth where they are. So it's important to consider how a young person's environment, their self-identity, their sense of autonomy, their self-esteem, all of that's going to play a role in their treatment experience. And so by discussing these factors, we start to develop a flexible, responsive approach that fosters connection, not compliance. So just take a moment on your own sheet of paper and answer those two questions. What makes working with adolescents challenging? And what do you think you should focus on during sessions? Should you focus on the substance or something else? What are the issues that may affect the outcomes of the counseling session? Are there any issues that may affect young clients' abilities to stop using drugs? So take about 10 minutes to write this down on your own sheet of paper. We know that adolescents are in a constant state of physical and emotional and behavioral development. They are navigating some really rapid brain changes, and they're forming their identity, and they're transitioning into social roles. And these changes are going to affect their risk-taking. It's going to affect their impulse control and their emotional regulation. All of these are tied to substance use and recovery outcomes. So understanding these developmental tasks are going to help us calibrate expectations. These kids may not, show insight or maturity. And it's not because they don't care, but because their brains are still wiring themselves for adult reasoning. Our role is really just to offer support, not judgment here, and to guide them through this time with structure and empathy. So as we're looking at the normal developmental tasks of adolescence, it's going to be important to remember that this particular stage is really marked by rapid growth. Physical, emotional, social, cognitive growth, all of that's happening. And adolescents are just adjusting to those physical changes of puberty, which then in turn impact their self-image and their peer interactions. Also, they're starting to explore their sexual identity, and they're taking responsibility for their emerging sexuality, and that's going to include setting boundaries, and we're going to have to help them navigate relationships and understand consent. And these developmental shifts can often create confusion or maybe even insecurity. And they're going to start to experiment. And sometimes that's going to overlap with substance use. And then in addition to these internal changes, the adolescents are going to work towards greater independence from their parents. They're trying to spread their wings. and fly away. So they're distancing themselves and they're developing a personal identity. And they're asking questions like, who am I? What do I value? And they're beginning to form deeper peer relationships and navigate social roles. A lot of them are exploring job paths or educational goals. So they're thinking about their future careers. And all of this is unfolding while the brain is still developing critical executive functioning, like planning and impulse control and risk assessment. So when that young person is struggling with substance use, it's going to interfere with those core developmental milestones. Or conversely, these milestones are going to, lead to being stressors that are going to lead to experimentation and then ultimately dependency. So as counselors, we have to recognize where a youth is in their developmental process. So that's going to help us to tailor our approach to being supportive, not punitive. So during late childhood and early adolescence, the brain is going to undergo a really remarkable transformation. And one of the key processes at this stage is the rapid increase in neural connections or synapses throughout the brain. And this overproduction of the connections allows for learning and adaptation and exploration as the brain is really just preparing for the complexities of adult functioning. But around the age of 11 in girls and 12 and a half in boys, the brain begins a process known as synaptic pruning. This is just a natural and necessary mechanism where the brain is eliminating connections that are rarely used, and they're making the remaining pathways stronger and more efficient. So think of it as clearing out the mental clutter. The brain is refining itself for specialization based on experience. And this pruning begins in the back of the brain, and then it's going to start to move forward. So that's going to mean that the higher order reasoning skills like planning and impulse control and judgment, they're all among the last to mature. So this neurodevelopmental lag is going to help explain why adolescents may be capable of abstract thinking in one moment and highly impulsive and emotionally reactive the next. And understanding this is going to help us to stay patient and adjust our expectations when counseling youth in treatment. And when the pruning is complete, that brain is faster and more efficient. But during that pruning process, the brain is not functioning at full capacity. The adolescent brain is literally under construction. So during early adolescence, the brain starts a process called synaptic pruning. And so we're going to remove all those unused neural connections. And this is going to help to streamline efficiency. But this pruning doesn't happen easily. The areas responsible for judgment and decision making are developing last. So the adolescent may understand the consequences intellectually, but still engage in the risky behavior emotionally. They're relying more on emotional centers of the brain when making decisions, and that can lead to the impulsivity. So treatment has to account for this neurobiological gap, and we have to use repetition, experiential learning, and also positive reinforcement to build those healthier patterns. So you can see that back here we have the physical coordination. This is in the cerebellum at the back of the brain. The motivation comes from the nucleus accumbens. Emotions are coming from the amygdala. And then the last to develop is that prefrontal cortex and their judgment and higher level reasoning. So by the time that a person reaches the age of 24, that's when we start to see a balance. We know that the adolescent brain is really uniquely susceptible to both harm and healing. And substance use is going to hijack their reward system. and that's going to create a stronger pattern of addiction. But this same neuroplasticity also is going to make adolescence a very powerful window for intervention. So positive experiences like mentoring, group support, healthy peer engagement, that's going to rewire the brain towards resilience. We know that the mesolimbic region, the midbrain, is all about motivation, exploration and learning, social behaviors, impulse control. The prefrontal cortex at the front, right behind the forehead, is our executive functioning. This is where we have goal setting, planning, priority setting, impulse inhibition. The child is under construction. They are a work in progress. So they're pruning, they're rewiring, and during these critical stages, they're restructuring, shedding some of those synapses and adding some synapses. They're developing from the back to the front, and so that's going to lead to treatment implications. This work in progress brain needs guidance, not punishment. Our role is to provide opportunities for learning and to regulate expectations and foster that emotional safety that's going to allow that child to grow. And when we understand the developmental science, we become a little bit more patient and strategic and more effective clinicians. So we have to make sure that we're understanding the disconnect between the feeling brain and the thinking brain. And we know that they're susceptible to change by good and bad experiences, and they're susceptible to drug rewards, and that's going to mean that there's a heightened risk of addiction. So working with youth is going to require comprehensive, developmentally sensitive approaches. Effective treatment is going to include individualized planning, family involvement in the treatment, appropriate programming. It's going to need staff with cultural and gender competence, and also outcome monitoring. Adolescents need consistency and structure, but also they need flexibility and autonomy. Retention is especially challenging with this population, so engagement strategies have to be proactive. Building rapport, involving the family, making the treatment relevant to the adolescent's goals and interests can really help improve outcomes and reduce dropout. These are the key principles that make adolescent work more successful. First, we know scare tactics don't work. They often backfire. Think about the DARE programs or the Scared Straight programs. None of them have worked. Adolescents respond better to structure, clear boundaries, and the ability to make their own choices within limits. They value being heard more than they value being talked at. And adolescents also need to feel respected. They need to feel seen. So trying to be their friend or acting like a peer often undermines that trust. Instead, you want to position yourself as a consistent, safe adult who listens well, provides direction, and gives them space to grow through their mistakes. Adolescent counseling is going to require humility and flexibility and a lot of creativity. Don't assume that you need to speak their slang or that you have to have used drugs yourself to be relatable. Adolescents value authenticity, not imitation. So focus on accurate information, adaptable strategies, and building trust over time. Be realistic here. Some kids, abstinence is going to maybe not be the immediate goal, especially in harm reduction settings. So we have to balance engagement with accountability, offering a safe space for teens to return even after they relapse. It's about relationships, not rules. And these relationships are the most powerful change agents. So we want to make sure we're using appropriate counseling skills and techniques, correcting any misinformation. We don't have to be drug users to be able to counsel young people. Don't expect to know all the language that they're using. Be flexible in considering your treatment modality. And just understand that the adolescent may identify more with the counselor than the agency, and it may take longer to build trust and rapport. And again, abstinence may not be the goal for some adolescents. Risk reduction may be a little bit more realistic. So when we role play scenarios like this one, it helps to give us a little bit more practice in our skills in real time. So in this exercise, a teen is mandated counseling and accompanied by a concerned family member. This is just like a realistic setup, as a lot of young people come to treatment through external pressures. So the goal of this activity is to explore how to engage resistant clients and navigate family involvement. Pay attention to tone, nonverbal communication, and your ability to validate both the client and the family member. These practice sessions build confidence and reveal some opportunities for improvement. So this is a 15-year-old drug user who has been sent to drug counseling by the parents, and you're concerned as a clinician about how to manage and support the client to quit using drugs. So you can role play this with another person, or you can put this scenario into ChatGPT and ask ChatGPT to play the client while you play the clinician. Working with youth is going to bring predictable challenges like confidentiality, missed appointments, relapse, mistrust, things like that. And teens often feel skeptical of authority, and they're pretty hesitant to open up. Absolute confidentiality cannot be promised, especially when safety is a concern, but we want to be transparent about the limits, and that's going to help build trust. We want to normalize relapse as part of the recovery process. The goal isn't perfection, but progress. So helping youth feel safe returning to treatment after setbacks is going to reinforce that message, and that their worth isn't defined by their mistakes. So we know that adolescence is a period of profound change, physically, emotionally, and socially. So these changes are going to increase the vulnerability to substance use, but also offer really incredible opportunities for growth and healing. And when we tailor treatment to adolescent needs, we're creating a space for transformation. Effective work with youth includes understanding brain development, creating safe and respectful relationships, involving families, offering structured but flexible interventions, and above all, success is going to come from connection and consistency and compassion. These are the building blocks of recovery in adolescence.